Canada is in the midst of an opioid crisis that has resulted in increasing morbidity and mortality with devastating effects for people, families, and communities. Between January 2016 and September 2018, there were more than 10,000 apparent opioid-related deaths in Canada. More than 11 Canadians and 130 Americans die every day from an opioid-related overdose. The relationship between the opium poppy and humans began over 10,000 years ago. The ancient Sumerians of Lower Mesopotamia referred to the plant as Hul-Gil, meaning the joy plant. Since its discovery, opium has been used in various cultures for reasons including medicinal, recreation, and spiritual. In 1804, chemist Frederick Saturner isolated morphine from opium, adding a member to the soon-to-be extensive class of drugs known as opioids. Morphine, largely used to treat medical conditions such as anxiety and pain, quickly rose to popularity. The discovery of morphine created a snowball effect. In a short amount of time, a wide variety of opioids, either derived from opium or synthesized in laboratories, were available for use. The most popular opioids often prescribed by doctors for chronic pain or post-surgical procedures include codeine, morphine, oxycodone, and fentanyl. The 20th century marked the beginning of the era of prohibition and the rise of aggressive pharmaceutical marketing. Throughout this period, the use of opium grew in North America and Europe. In 1908, Canada enacted the Opium Act, which banned opium for non-medicinal use, making it a legal offense to possess, import, manufacture, sell opium for recreational use as well. The ban on opium was seen domestically as a response to the Chinese problem. The offensive colloquial term, Chinese problem, referred to smoking opium, a popular form of recreation among Chinese immigrants, which in part fueled the Canadian opium trade. Fast forwarding to the 1950s, synthetic opioids such as oxycodone were becoming popular among doctors looking for effective ways to treat pain. The medical field's reliance on synthetic opioids for pain management and treatment continued into the 1980s. Pharmaceutical companies eager to pique the interest of the medical community increased marketing efforts to healthcare providers. This in turn led to substantial growth of the opioid market. In 1996, Purdue Pharma began to promote and aggressively market a synthetic form of oxycodone, commercially known as OxyContin. The pharmaceutical company, eager to monopolize the pain management and treatment market, downplayed its addictive potential and inflated the drug's effectiveness. It wasn't until the 2000s that the courts began to realize the dangers posed by the pharmaceutical promotion of opioids. Recently in Canada, Purdue Pharma settled on paying $2 million to provincial health plans and $20 million to compensate for how the company distributed and aggressively marketed OxyContin. Opioid drugs are typified by morphine and produce pharmacological actions such as analgesia, mood changes, physical dependence, and tolerance by acting on receptors which are located on the neuronal cell membranes in the CNS and PNS. There are three types of opioid receptors, M, D, and K, which are all coupled into intracellular mechanisms via G proteins. The major effect that opioids have on the nervous system are when they act on the presynaptic neurons. When bound, they will inhibit neurotransmitter release. The opioid antagonist, naloxone, inhibits all opioid receptors but has the highest affinity for M, whereas opioids that target K receptors do not produce a high physical dependence. Tolerance and dependence are marked by chronic exposure to morphine and other opioids, and increased usage leads to receptor desensitization. Dependence is characterized by the removal of a drug from its receptor, which can lead to a withdrawal response. 53% of opioid users obtained their prescription from a friend, and 81% had their own prescription. More than 10% of these patients progressed to chronic use, which is defined as ongoing treatment for more than 3 months. Although most people are seeking neurophic effects from the drug, some have developed a dependence through chronic use and are trying to avoid withdrawal symptoms. Discontinuing opioid use is extremely difficult because tolerance results in dependence, addiction, and dose escalation. Unfortunately, most patients believe they need ongoing therapy because of the withdrawal symptoms and quickly learn that reconsumption of the prescription remedies these symptoms, which reinforces the perception that chronic therapy is beneficial. When access is lost, many patients turn to heroin because it is relatively inexpensive and easy to obtain. There are lifelong implications of this disease that far outweigh the treatment of pain. The next steps proposed to combat the opioid crisis are based on 4 pillars. First being prevention, which is combating overprescription behaviors and educating both prescribers and patients of the harmful effects of opioid use. Second is treatment, which is facilitating better access to medication and therapy related to overcoming opioid addiction and increasing collaboration between social services and the criminal justice system to treat individuals incarcerated for drug offenses. Third is harm reduction, which is facilitating access to overdose response drugs, changing legislation to encourage individuals to seek emergency assistance without fear of legal consequences, and increasing awareness of existing support. 4 is enforcement, which is restricting the production of precursors to synthetic opioids, enhancing cooperation between jurisdictions to target drug trafficking, and increased training of law enforcement officers to investigate and act on drug-related offenses. With these steps in place, a future with controlled opioid use will be possible.